So I think I was going to take it from the vantage point of like an actual story to sort of personify the situation. So just imagine a 96-year-old grandmother that lives with her 32-year-old granddaughter because their mother passed away a few years ago. The granddaughter just has a 2-month-old. She's the breadwinner. She's on maternity leave. Husband's essential worker, needs to leave the house every day. So every day he comes home, he has to take off his clothes and he has to make sure that he's away from his grandmother because she's obviously elderly and she's of color and he doesn't want to get her sick. So him working creates a burden for him and the family. And now they have to be in different rooms, but they're in a 2-bedroom apartment in the city, so there's not a lot of space, right? They're nervous about the aide that comes to the home that takes care of the 65-year-old grandmother because that grandmother has long-term care. The aide is actually working other jobs because hours are going down. So that aide now has to work at the hospital to get extra hours. So the aide is exposed to COVID because she's working at the hospital, because her current job, she's losing business because she's not getting as much hours as she used to. And then that family is also saying, I don't want the aide to come over because I don't know if the aide's going to bring COVID into the home. The mother has to go grocery shopping with the baby because the husband's away. So now the mother's bringing the baby around people and she's a wreck because she doesn't want to keep her 2-month-old exposed in the city, either taking the subway or the bus or the grocery store that is too small in these neighborhoods of color to have to properly social distance. And these grocery stores don't have the masking tape that keeps people 6 feet apart before you walk in. And they don't have the nice circles and the stickers that keep you 6 feet apart with the grocery cart. And so all this is happening, and then protests happen, and the state institutes a curfew, so you have to be home at 8 o'clock. The husband gets off at 9. So now every time he comes home, he's worried about the police stopping him and making sure that he has his ID to show that he's allowed to be out after hours. And he comes home, maybe he doesn't get stopped, so he feels relief, but he has to take off his clothes, put them in a garbage bag, separate himself from the family because, again, he was out and he was exposed. And when they tried to get a test, they couldn't get a test. And this is emblematic of systematic racism because the criteria for testing was you had to have traveled in the last 14 days when the pandemic first happened in February, or you had to have had been proven to be next to someone who was positive. So because they're not of means, they haven't traveled, so they can't get a test. And they don't have symptoms, but they just want to be careful to make sure that they don't have symptoms because they live with an elderly grandmother. So they routinely got declined from a test, waiting online for hours. They don't know people in the healthcare field that they could just call up the phone, a CFO, a CEO, because they're of color, and the leaderships of all these hospitals don't have the same diversity to say, hey, I just need a test, can you get me in line? And so that's the world that patient is living in. And that's my grandmother. That granddaughter, that's my cousin. So we fight it for our members and we fight it for our own family. And that's the situation that they're dealing with. That's like social determinants come to life in someone's life. And all they're trying to do is get the paycheck that they need. They're thankful that they have a job. They don't want to say they're sick because if they don't work, they don't get a wage. So even if you are sick and they say don't come to work if you feel symptoms, they feel obligated to go because they have to put food on their table. And the money that the husband's earning is specifically for the wife to buy groceries with the baby that's in the store that's too small to social distance. So I think we say social determinants and we try to use member stories so that it's real for people, so they understand that every transaction we do as a payer is real. There's a member at the other side. Our CEO, Pat Wog, always says what we do matters. But when you're a minority in the payer, it's not just a story. it's a way of life, right? And so we get paid to do our absolute best to do everything we can for our members. And my hope is that we can make these stories diminish with the work that we're trying to do collectively. And I'll just say, when COVID happened, I think everyone in the industry got an email about, in light of COVID, here's what we're doing. In light of COVID, here's what we're doing, right? Like the cable companies said, you don't have to pay your cable bill. We'll waive it for the next 2 months. Or, your car dealership said, hey, you have a lease. We'll suspend your payment for 3 months. And so it's enlightening to say we could have done this before COVID. We didn't have to wait for a pandemic to give people grace and to give people a chance, because we're doing it now and these companies are still thriving. So I hope that we don't wait for a black body to die, or we don't wait for international pandemic to do the things we knew we should have done in the first place.